giving us the opportunity to share. I am sorry, my French is so limited, so I cannot present in French. So we are very pleased to share some of the work that I've partnered with OLIP to complete this past year, building capacity to plan for health equity in the data collection of collecting race-based data. So I'm just gonna, next slide, please. Thank you. So Mona and I would be sharing that with you. They already introduced us, and the OHTN stands for Ontario HIV Treatment Network. Those are the funders of my, the provincial funder of my research chair. I'm going to stop there, and Mona, you can take it over.
Sorry, thank you, Dr. Toa. I was having a bit of trouble with the mute button. So really the content of our presentation, and it's going to be sort of in line with the purpose of this immediate panel, but also, you know, what's been discussed so far today, is we'll talk a little bit about the role of RLIP, so the Ottawa Local Immigration Partnership, and the work that we've done, as well as how we've sort of built capacity and infrastructure for the collection of disaggregated data, really to inform health equity. And then we'll speak a little bit about the conceptual framework that sort of, and the measurement framework that guides health equity. And I'll bring in a few of the stories that we've collected, immigrant accounts of the pandemic, and how we've used both quantitative and qualitative data sources to speak to the experiences during the pandemic. So briefly, I know with the BMC group, many of you are familiar with LIPS and how LIPS work. So I'll just introduce this very quickly. The Ottawa LIP, as is the structure with many other LIPs across the country, is multi-sectorial partnership. We have over 60 organizations who've sort of committed and have representing 6 different sectors who've sort of come together with a common vision, shared priorities around immigrant integration. And specifically, many of these priorities and this overall vision is outlined in the Ottawa Immigration Strategy. We also have a governance structure, I think, that is very unique to ensuring a collaborative process in how we plan, but also having creating a platform where partners can connect regularly and build around strategic actions. So specifically, we sort of focus on 4 target areas: economic integration, really the continuum of accessible settlement, social, education, and healthcare services, supporting organizations to be inclusive and equitable, and building community connections, really being able to connect with the knowledge and the intelligence that exists in community about inequities, and using that to sort of catalyze planning and how we do our work. So within that context, within that structure of OLIP, we've really focused on building grounded knowledge throughout the pandemic and building data capacity and data infrastructure across organizations. So this includes multiple components, as is the complexity of data. We've sort of brought in the importance of population experiences, being able to bring in community perspectives, ensure community is meeting with public health units, with schools, to figure out exactly what the issues and challenges are, and then to also work with organizations to adequately research communities. This involves surveys or other data collection efforts that organizations are doing to gather that insight. Equally though, as inequity is sort of sustained by both individuals and structures and organizations, we sort of bring in organizational experiences. We work with our partners to identify what is their capacity for using disaggregated data, what are their approaches, what are some of the barriers, and then how can we sort of evaluate some of the efforts they're taking to ensure that really the resources are using in a way that is responsive to community needs and that reflects the challenges of the pandemic. So this involves working with organizations to identify challenges, to help build that capacity, but then also to move forward and assess the impact of the work that they're doing. Part of building this grounded knowledge, having the community experiences, having the organizational challenges sort of documented and recognized, is also building a comprehensive conceptual framework, this overarching framework that really brings together all these different components. Really the complexity of our work is that it involves, as you know, determinants of health is, it's many aspects of people's lives that are coming together to create and to then perpetuate
inequities. So really part of our work here and what we'll discuss with you quite a bit today is this framework and measurement that we work together to develop.
Okay, so I'll take it from here. And so my team at the University of Ottawa partnered with OLIP and Canadians of African Descent Health Organization to work on these components of OLIP strategy. Basically, a key part of this was to build evidence and data infrastructure to improve how OLIP plans for its work. And so the objective of the components we worked on was to develop a framework to examine the social determinants of health related to COVID-19, including the layered micro, meso, and macro level neighborhood factors. And so we looked at the structural, institutional, community, interpersonal, and individual level factors that impact on health and COVID during this past pandemic. We identified indicators to measure the social determinants of COVID-19 related inequities. So I know we can't do justice in the 10 minutes we have, but I would just share briefly with you the framework that we suggested. And this framework has been published, so you can actually access the article to read it in full. Next slide, please. And so we were very particular about using a socio-ecological model that would help us to capture the levels of determinants of health and COVID-19. We looked at what kinds of things should organizations be looking at when they're thinking about collecting data to measure the determinants of this. And so looking right from macro level determinants, what are the laws and policies that organizations or institutions have in place that affect the racialized and immigrant people? What is the availability, accessibility, and adequacy of resources and opportunities that influence the distribution of necessary and desired conditions or services for these individuals? So when we're looking at neighborhood and trying to analyze the issues that affect that neighborhood, we need to look at these multiple levels of issues. What are some of the governance and spending in terms of amount of spending available or used to support programs and interventions in, say, the region or neighborhood you're looking at? What are social norms and values that may be influencing work there? Then we looked at the meso level determinants. So again, futures and relationships among organizations and institutions at the community and at the community level that may impact on health. Again, there's so many examples we've given here, spaces, places where people work and interact that may include community neighborhood characteristics, such as community cohesion, social and faith networks and support, social norms, community values, and all that may affect the local amenities and other issues in the community. And then the last level here is the macro level, micro level determinants, where we look at family or individual level factors. For example, how does marital status, income, education, occupation of individual family members, how do all of these impact on their stress and other areas that can be associated with COVID? Next slide, please. We also looked at those critical intersections. So not only were we interested in the socio-ecological model of looking at the level, but what are some of those critical intersections that actually compound these issues for the population, whether you're looking at racialized community, immigrant people. And then we divided that into domains that impact on the development of health outcomes. And so within that domain, we're looking at it if organizations are collecting data or analyzing data around these issues, they need to use this domain to help them to identify the indicators that they would be collecting and measuring in this. And you can see here the 6 domains, functional domains we've identified. Again, building on existing literature, these domains have been identified by others, as you can see in some of the literature we cite there, and we pick these. We use some of the available databases to look at neighborhood data, both in Ottawa. We looked at crowdsourcing data from Stats Canada to help us see how those indicators fit within these different domains. So the policy domain, you can see examples there. We're talking about immigration policies, laws and policies addressing income adequacy, housing, and those different pieces. Then we looked at economic domain as another aspect that can help us identify indicators in that area. So education, income, employment, social and family domain to look at family structures and social support that families may have, which would have impact on how they've coped during the pandemic. Institutional domain, access and use of healthcare services is an example of institutional domain. And health domain, we're thinking about health literacy, racial literacy for racialized people, health behavior, health beliefs, all of those, and coping skills were key areas in that domain, and of course, community domain. So I'll pass it back to you, Mona. That's your mute.
Sorry about that. Yeah, just play, sorry about that. Okay, so exactly what Dr. Josephine was covering is really this overview, this framework that guides much of how we approached how the data was collected and what advocacy work can be done, bringing in both the spatial and the community, as well as the individual characteristics to build a more coherent narrative. As we worked closely with partners, and given that this is sort of a partnership and we are engaging with community directly, many people were asking, well, what are the data indicators? What are the points that we should be looking at? And how do we know what's important? So OLIP had a series of community engagement sort of efforts where we drew on and said, listen, there is this disproportionate impact. What are the stories? What are the realities? And how can we use this conceptual framework and start to build in the different pieces? So just to capture some of that work, I wanted to share this story. Now, this story was developed as a direct result of some of the outreach work that was done by our local public health unit. They had a local outreach community of practice. I worked with the service providers and to build sort of narratives of immigrant accounts. And part of this work was really to try to understand the complexity of inequities during the pandemic, and then start to look at where organizations played a role and how individuals could be supported. So I'm just going to go ahead and read this, and then after, usually, you know, I'll probably just give it a few seconds for everyone just to sort of absorb the story. I find it's very real, and it is the lives of people that are based on real experiences. Okay, so this is the story of Adam, and it's a hardworking father who's really kind of highlights the economic and mental health sort of inequities that were experienced by many community people. I leave my home and family every day to work, but I barely have enough to survive. I work a frontline minimum wage job, and I rely on crowded public transit to get me there. They say we're essential, but really we're the only ones desperate enough to leave our homes every day, in spite of the risk to ourselves and our families. We're so unprepared. I look around on the bus and only see Black and brown faces. It is like our lives don't matter. With the rest of the city staying home, setting up their home offices, I'm working night and day, just trying to feed my children in a global pandemic, afraid that I will get this virus and bring it back home to my family. I have already seen friends and neighbors become sick.
then hospitalized, some even die. It is as if we will either die from starvation or from this virus. This reminds me of the war we fled when we came to Canada as refugees. I'm reliving those memories as I try to survive this crisis.
I hate to jump in, but just to let you know, you've used 15 minutes.
This is the last slide. So just to give us a minute to sort of contextualize the story, really it was a way of capturing in the absence of really detailed data on disaggregated data from organizations. We were able to use stories as a way of capturing the complexity of these challenges. And then I guess the next one, Dr. Josephine, do you want me to speak to this, or
sure,
I'll wrap it up? Okay, sounds good. So really the work of the partnership is to identify exactly, now that we know these stories, now that we've collected this information, what can be done